There's a quiet moment many men notice in the morning. You're awake before the alarm, sunlight just starting to lift the room, and you can tell something is muted. Not pain, not illness, just the missing edge of readiness you remember from younger years. As a urologist who's walked alongside thousands of men in their 50s and beyond, I can tell you this isn't about willpower, masculinity, or trying to be 25 again. It's about biology, recovery, and how simply and consistently you support the systems that make you feel steady, capable, and alive. I'm Dr. Leywin, and I want to invite you into a 2-minute evening ritual that's gentle, evidence-informed, and surprisingly effective when practiced consistently. Not a gimmick, not a promise of miracles. A small, intelligent nudge to the parts of your physiology that carry you through the night and set the tone for your morning. Your blood vessels, your nervous system, and the hormones that depend on deep, unbroken sleep to do their best work. First, the why. Because understanding is empowering. With age, the lining of your blood vessels, the endothelium, becomes less responsive. Think of that lining as the intelligent skin of your circulation. When it's healthy, it releases nitric oxide, which tells vessels to relax and open at the right times, so blood flows easily to the heart, brain, and yes, the pelvis. When it's stressed by inflammation, high blood pressure, high blood sugar, poor sleep, or a lifetime of small insults, the signal weakens. Erections, which are a vascular event before anything else, become harder to achieve and sustain. Morning erections, in particular, are a useful barometer of endothelial health and sleep quality. They tend to fade when nighttime recovery is compromised. Testosterone, which we often blame or chase, is part of the picture, but not the whole story. It naturally declines gradually with age. More importantly, its overnight secretion is tightly tied to sleep architecture. Deep, consolidated sleep supports healthy morning testosterone. Fragmented sleep blunts it, and sleep itself changes with age. Less slow-wave sleep, more awakenings, more time in lighter stages. So anything that calms the nervous system and improves nighttime circulation becomes disproportionately powerful. This is where an evening infusion can help. The combination is simple: a small splash of pure pomegranate juice, a few slices of fresh ginger, and warm water. Not as a cure, not as a replacement for medical care, but as a consistent signal to your body to downshift, hydrate the right way, and deliver polyphenols and soothing compounds when they can do the most good. Let's talk pomegranate first. This fruit is rich in polyphenols, especially punicalagins, that act as antioxidants and support endothelial function. Across multiple randomized trials and meta-analyses published over the last decade and into 2024, unsweetened pomegranate juice has shown modest improvements in blood pressure and measures of endothelial health. In plain language, it seems to help the inner lining of your vessels respond better, likely by enhancing nitric oxide bioavailability and reducing oxidative stress. That doesn't turn it into medicine, but it makes it a clever ally for cardiovascular and pelvic blood flow. Because it contains natural sugars, the dose and timing matter. A small amount, diluted and taken well before lights out, avoids unnecessary glucose spikes. Ginger earns its place not for spice, but for science. Human studies show ginger can nudge down inflammatory markers, soothe the stomach, and even modestly improve blood sugar in those with insulin resistance, all of which support vascular health. Preclinical work suggests ginger compounds can influence nitric oxide pathways and endothelial function. And while that mechanistic data is early, it aligns with what I see clinically. Many men sleep a touch easier and wake less heavy when ginger is part of their evening routine. It's not a stimulant. It's a quiet mediator, working with your physiology rather than against it. And the warm water? No, it won't magically dilate arteries throughout your body, but warmth does matter. Warm liquids relax the esophagus and stomach, increase comfort, and encourage a parasympathetic shift, the nervous system mode associated with rest and digest. That shift is the doorway to the hormonal pulses and cellular repair that happen mostly after dark. Warmth also helps extract and diffuse the active compounds from ginger more effectively than a cold drink. What you're creating is less a beverage and more a bedtime message: safe, calm, unhurried. If you were in my clinic, here's how I'd teach you to do it. About 90 minutes before bed, earlier if you're prone to waking at night to urinate, place 2 or 3 thin slices of fresh ginger in a mug. Add hot, not boiling, water and let it steep 5 to 10 minutes. Once it's comfortably warm, add a small splash of 100% pure pomegranate juice, usually 1 to 3 ounces, depending on your taste and blood sugar goals. Then top with a little more warm water. Sit. Don't rush. Sip slowly. Finish the cup, visit the bathroom, dim the lights, and give yourself permission to coast into sleep. If you live with nocturia from an enlarged prostate, keep the total volume modest and complete the drink at least 90 minutes before you lie down. Now, because science matters more than slogans, let's be clear about what to expect. In controlled studies, pomegranate's vascular effects are modest, not dramatic, and they accrue with consistency. Ginger's benefits are also modest but meaningful, especially for people with low-grade inflammation or digestive tension. The magic isn't that a single cup changes your life. The magic is how a small, reliable ritual shifts multiple systems in the same direction: less evening stress chemistry, better endothelial signaling, gentler glucose handling, calmer digestion, and more readiness for deep, consolidated sleep. Over weeks, those small gains add up. Many men report a steadier pulse through the night, fewer awakenings, clearer mornings, and a quiet return of that automatic signal of healthy blood flow when dawn arrives. There are 2 more layers that amplify this effect. The first is movement. After dinner, a slow 10 to 15-minute walk lowers the glucose and blood pressure surge that otherwise taxes your vessels and nervous system. Even small reductions in post-meal glucose translate into less oxidative stress at the endothelial level. If walking isn't possible, a few minutes of gentle floor stretches or lying on your back with one hand on your chest and one on your abdomen, breathing through your nose with a long, easy exhale, can raise vagal tone, the metric of parasympathetic activity associated with deeper sleep and more stable overnight hormones. None of this needs to be heroic. In fact, the restorative pace is the point. The second is the environment you create. Blue light, late-night news, and scrolling prime your brain for vigilance. Dim the room, lower the volume on your day, and let the ritual be a boundary. There's growing evidence that predictable, soothing routines before bed improve sleep efficiency and reduce autonomic arousal. Your body learns that these cues mean safety, and safe bodies fall asleep and stay asleep more easily. A word about expectations and safety, because that's part of responsible care. If you're on blood thinners, have a bleeding disorder, or are preparing for surgery, talk with your clinician before using ginger regularly. If you're on medications metabolized by the liver's CYP3A4 pathway or certain statins, ask whether pomegranate juice is appropriate for you. Interactions are uncommon but possible. If you live with diabetes or pre-diabetes, choose unsweetened pomegranate and keep the portion small. Or consider diluting a teaspoon of pomegranate concentrate in a larger mug for the polyphenols without much sugar. If reflux flares with ginger, reduce the amount or switch to a gentler herbal like chamomile for the warmth and calming. If kidney stones have been an issue, tailor the plan with your doctor. And if new erectile difficulties appear out of the blue, especially if you also notice exercise intolerance, chest pressure, or breathlessness, please don't self-treat. Erectile dysfunction can be an early signal of cardiovascular disease, often preceding heart symptoms by years. A check of blood pressure, lipids, blood sugar, and sleep apnea risk is not just reasonable, it's wise. You might be wondering whether a drink can really move the needle if hormones are dropping. Here's the nuance: testosterone matters, but it doesn't act in isolation. It rides on the back of good sleep, healthy vessels, and stable metabolism. Deep sleep supports pulsatile testosterone release and its receptor sensitivity. Endothelial health determines whether that hormone can translate into function where it counts. A small nightly ritual won't take you back in time, but it can help restore the conditions under which your current biology performs at its best. That's the mature, sustainable win. Let me leave you with a picture from my practice. A 62-year-old man, call him Michael, came in not for erectile dysfunction, but for a sense that mornings had become grey. He wasn't depressed. He exercised. He loved his wife. But the effortless morning readiness, a signal he'd always taken for granted, had thinned out. We tuned his basics: a short walk after dinner, the warm ginger pomegranate infusion 90 minutes before bed, lights dimmed, phone away, a simple breathing pattern with a long exhale as he finished his cup. Nothing radical. After 4 weeks, he didn't brag about records in the gym. He told me with quiet relief, "I wake up and feel like myself again." Not every man reports the same thing, and that honesty matters, but enough men do. Paired with the physiology we understand, I offer this ritual often. So if you're ready to try it, give it a fair test. Mark 14 nights on a calendar. Make the infusion the same way at roughly the same time. Pair it with a little evening movement and a gentle wind down. Notice not just whether mornings change, but whether you fall asleep faster, wake less, or think more clearly at sunrise. If the ritual helps, keep it. If it doesn't, we'll adjust. There are other polyphenol sources like hibiscus or blueberry, and other vasodilatory foods like beetroot you can use earlier in the day. There are pelvic floor strategies, sleep apnea evaluations, and cardiometabolic tune-ups that change the story in deeper ways. The point is not to chase youth. It's to invest wisely in the body you have now. There is dignity in small, consistent acts of care. A warm mug in your hands, a calmer breath, a body reminded that nighttime is for healing. That's not a trend. That's physiology. And you deserve to feel what your body can do when you stack the biology in your favor. This is general information, not a diagnosis or a personal treatment plan. If you have medical conditions or take prescription medications, check with your clinician before making changes. But if tonight you feel ready, step into the kitchen, slice the ginger, warm the water, add a modest splash of pure pomegranate, and sit. Let the day settle. Sip without hurry. Then sleep, and let your body show you what quiet consistency can restore.